Hey, what's going on, everybody? Today we're going to be talking about how I treat patients with C19. And so with this, there are a lot of videos coming out about what practitioners are doing or how to solve this problem. But when it comes to addressing what the root cause of the issue, not just giving you any type of symptom relief, you have to understand what the mechanism of C19 was. And when this came out, a lot of doctors were scrambling to figure out what was going on, what you could do to help with it. But one of the biggest issues that we've seen post C19 is that a lot of people are still struggling with energy, fatigue, brain fog. They're having a lot of sleep issues. There are many things that are happening from like an energy standpoint. And I'm going to be explaining today about how that's affecting the energy pathways, what I have used in the past in order to help people overcome this, because it's very simple actually. And then just about more complicated cases that I've seen, things that we needed to do differently. So I'm going to outline all of that for you today. Now, I want to make sure that this is how I've helped people with it. It doesn't mean that it's the only way. It's just the way that I have found that has worked best for my patients, so that they could get their energy back, so that they could sleep better, so that they get their smell and taste back, which was pretty interesting to see. And so when it first came out, I was part of a group of doctors that were really into functional medicine, and we were doing a lot of testing. We were doing organic acids, gut tests, a lot of different tests. And the most interesting thing was the organic acids test that we were doing on these patients that were having these symptoms or that had been infected with C19. And what we found in these organic acids tests was that these people were having issue with the Krebs cycle. Now, just from a basic biological standpoint, if you understand the Krebs cycle is what makes all of your energy. So if there's any issues in your Krebs cycle, you're not going to have as much energy maybe as you used to. And what we were finding is that it was affecting this certain pathway called the carnitine pathway, which gets amino acids into the mitochondria so that they can go through this whole process of energy production. So it makes sense that if you don't have the amino acids, or if you're blocking this L-carnitine pathway, that you would have energy issues. And by supplementing these patients with essential amino acids and helping move that pathway along, that shuttle into the mitochondria, we found that they got great results. They were able to regain their energy. Now, it did take some time. I don't want this to seem like, oh, you're going to take one dose and then you're automatically better. This is something that takes time to heal. It takes time to heal that pathway and do any damage from it. And I'm going to be talking about that later once we get into more specifics about how to treat it. But with this, now other doctors were seeing this as well, and there could be some variances, especially if you had a comorbidity, such as diabetes, heart disease, liver dysfunction, hormonal issues. All of those could play into it as well. And sometimes it was, if you already had fatigue due to one of these issues, then it was even harder to, help those patients recover, because not only did you have to address the C19 problem, but you also had to address those underlying issues. And if you didn't, then, people still felt bad. And they forgot that they were already tired before, which makes it a lot harder. So, like I said, other doctors were running these tests, these organic acids, so it wasn't just me. And what they found is that a lot of these people had similar patterns and had this same pathway. Now, they could have some gut dysfunction as well, or some other underlying issue that was kind of uncovered. But when we came to a consensus about what we were all seeing, a lot of the times it was this pathway. So basically, by driving this pathway with essential amino acids, you're able to get that energy production going again, and you're able to help these patients, basically reclaim their life, because a lot of these patients, they just weren't able to go to work. They didn't have the energy. They weren't able to be a mom or a dad or maybe a grandparent, whatever it may be. So this was really affecting their lives. And in about 30 days with most of our patients, especially if they were healthier, they would do great. And so we would do this twice a day. And the one that I use, I'll put a link into it below this, but the one that I use, it had, you know, all of the coenzymes that you needed with it, you know, your B6 enzyme or vitamins in order to fuel that pathway along, because that is a coenzyme that helps fuel along all of those pathways. So these patients sometimes will be B vitamin deficient as well. And I think a lot of people make the mistake that maybe, oh, they're like thinking maybe if I just do B vitamins, or if I do, you know, just like an essential amino acid powder, that it'll get better. Well, it was like the combination of them both work the best is what I found. So treatment for this, what I would do for my patients is that we would do essential amino acids. We do it twice a day. Then we would do fish oil. Now I would do fish oil 3 times a day. And there are no contraindications to fish oil. The only thing is that if you take too much of it, it's just going to get converted into fuel. And fats are a lot cleaner burning than your carbohydrates, especially if you're not an athlete. So I would do triple the amount of fish oil, and I would have my patients do it 3 times a day. That's going to reduce any type of brain inflammation, reduce any type of body inflammation. I do have some past videos about fish oil, so go and watch that. I used it when I was doing my doctorate to keep my brain inflammation down. And I was able, when I stopped taking it, I had more cognitive issues. I couldn't remember as well. I performed more poorly on my test. But as soon as I started adding that back in, my brain, it was like it supercharged a little bit. So it was pretty cool. The next thing is monolaurin. Now this is more of an antiviral supplement, and it's a little bit of a newer one. It's only come out in the past couple of years as far as I know, and it's a really good antiviral to knock that down. Now obviously you can do things like zinc and garlic to help with any type of viral or bacterial hidden infections. Oregano, there are a lot of different herbals. You can go back and watch my videos about you know, how you kill off bacteria or viruses naturally. Or if you do have a question, just comment below and I'm more than happy to answer any questions. Just know that it's not medical advice. I'm just telling you what I've done for my patients and what's worked for them. Now, in our more complicated cases, let's say if it's post-jab issue, then sometimes you'll have to use fulvic or humic acid in order to pull out any contaminants that are in the body. And these are really good binders. They're not like your chelating, they're not like your chelating materials that you see sometimes when you're doing like heavy metal detoxes, or you're trying to pull out some other type of parasite or something like that. These are typically safe. Most of the time you just have to worry about vitamin and mineral deficiencies with them. But overall, these are going to be great in order to pull out any type of post-jab issues. So yeah, I just wanted to run through that. I know that a lot of people have been posting about it, so I just wanted to put my 2 cents out there. If you have any questions, just comment below, reach out to me. I'll put the links to the supplements that I use down below. So if you want to try it, I would recommend that you do it. And like I said, you can ask me any questions. There's no contraindications to any of these either. But if you want to work with me personally, just reach out. I'm more than happy to help. And yeah, that's really all that I have. Oh, and so I know that YouTube is getting a little bit stricter about healthcare providers. So if you want to, I'm also going to put a link to my email list down below so that you can, you know, stay up to date on what I'm doing. I'm going to be coming out with actually an essential amino acid supplement that I'm going to formulate to help me with my energy, because there are some really good ones out there, but I want something a little bit more specific. So that's what I'm going to be doing over the next several months. So I'm excited about that. So thank you all for watching. I hope you all have a great week, and share this with anybody that you know that is struggling with this, because I think there are a lot of people that are, and let's get them some help. So thank you for being part of my community. And then also my Facebook group, I'm going to be doing some free lives in there. So if you need help with your health, or if you need coaching necessarily, I'm going to be doing that. We're going to start out with twice a month for right now, and I'll be announcing the dates and the times in my Facebook group. So be on the watch out for that, and see you all next time. Bye.